Good day, ladies and gentlemen. My name is J. Singh, dietitian from Pusat Penyelidikan Epidemiologi Pemakanan. Today, I will be presenting a study on the elderly population. The title of my study is Nutritional and Non-Communicable Disease Status Association with Fall Among Older Persons in Malaysia. Findings from National Health and Morbidity Survey, NHMS, Malaysia 2018. The outline of my presentation consists of introduction, methodology, results, and discussion. For introduction, a number of studies has been conducted to determine the risk factor associated with falls in older people. The identified risk factors for falls include demographic characteristics such as older age, female gender, unmarried status, and low educational level. Anthropometric measurements such as larger waist circumference, health status such as use of medication, low physical health, cognitive impairment, mobility impairment, visual impairment, history of fall, depression and malnutrition, and of course health behavior such as decline in activities of daily living, low or high mobility level, and alcohol consumption. Studies done by Damien et al. And Sibley et al. Showed the prevalence of falling increased in an individual with comorbidities compared to no comorbidities. Azida et al. Found that older persons with diabetes and hypertension had a higher risk of falling. Previous studies have proposed that older adults with obesity have a higher probability of falling than older adults who have a normal BMI. The objective of this study is to investigate the potential factors of concern, which are nutritional status of respondent and non-communicable disease association with incidence of falls, using National Health and Morbidity Survey NHMS 2018. Outcome of the study can then be used by tertiary clinics or hospitals to further manage patients' falls. For methodology, this study used data from NHMS 2018 and conducted a cross-sectional design by applying two-stage stratified cluster sampling. Descriptive statistics such as the percentage of each variable were done. Factors associated with falls were determined at both univariate and multivariable levels using simple logistic regression and multiple logistic regression. Data were presented as standard values for each analysis and adjusted odds ratios with 95% CI with p-values of less than 0.05. For further information on methodology, the audience can look up or download the study survey of NHMS 2018 from IKU website. As for the results, a total of 3,867 respondents from 3,977 elderly, mean age of 68.2, were recruited with a response rate of 97.2%. Factors associated with fall in relation with the sub-study objective were obesity with the adjusted odd ratio of 1.55, undernutrition, the adjusted odd ratio of 1.59, persons with 2 NCDs, adjusted ratio of 1.49, and persons with 3 NCDs, adjusted odd ratio with 1.63. The NCDs that we are referring to here are diabetes, hypertension, and hypercholesterolemia. For discussion and conclusion, our current study supports evidence that older persons with larger BMI have higher probability to fall compared to those who are not obese. Intervention studies of weight reduction in terms of fall outcome should be recommended for obese older persons. No association was found between large waist circumference with incidence of fall. This study also found significant association with incidence of comorbidities and fall. The diseases through direct and indirect effects such as reduced physical activity, weakness of muscular power, and balance impairment cause increased risk of fall. It is likely that the severity of specific malnutrition parameters is associated with recurrent falls and possibly injurious falls. Our study found significant association between malnutrition status and incidence of fall. Adequate nutrition provision, monitoring of chronic diseases by both older persons and caretakers should be taken into consideration for prevention of fall. Implementation of fall preventive programs can also significantly reduce falls among the older persons. In conclusion, falls are prevalent among the older persons, and there is an urgent need for public health strategies to decrease the incidence and early identification of who are at risk. Future research or studies on multiple risk factor intervention should be considered to reduce the risk of fall among older persons. This paper was published in the International Journal of Public Health Research on 1st September 2021. That's all from me. Thank you very much for your kind attention. Thank you.